Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Administrative Security. We will be starting shortly. We will wait a few moments for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Administrative Security. We will be beginning shortly. We'll wait just a few more moments for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Administrative Security. We will be starting shortly. We will wait a few moments for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance Administrative Security. My name is Amber Zopicki from the Marketing Department at BioMedix, the sponsor of this webinar. Our speaker today is Dr. Michael Brody. Dr. Michael Brody is a nationally recognized speaker presenting on health information technology and electronic health records. He is a featured health information technology writer for Podiatry Management Magazine, APMA News, and the PICA newsletter. Dr. Brody received his DPM at the New York College of Podiatric Medicine, is involved in resident education at VAMC Northport, and has been in private practice for over 20 years. We have just a few housekeeping notes for this evening. If you have questions, please type them in the question box on your right. We will have time at the end of the webinar to answer some of your questions. There will be survey questions at the close of the webinar. Please take time to answer them. We appreciate your feedback, and it will help shape our future webinars. After the webinar, if you have any questions that have not yet been answered, you can email info@biomedix.com. That's info@biomedix.com. At this time, I would like to introduce Dr. Michael Brody.
Thank you very much. Just as a little housekeeping note, this webinar is being recorded and will be available through the BioMedix website, so don't bother taking notes. You'll be able to listen to it and view it at your convenience once it's up on the website. I prefer that everyone sit back, listen, and try to absorb what's going on and what we're talking about, because there's a lot, and it's a lot that you do need to understand. From today, from the first view, you'll get a grasp of it, and after you read this a few times, and after you listen to the webinar a few times, you'll get a much better grasp and handle on what is going on in terms of HIPAA and the requirements you have for your office. Okay. Let's take an overview of what HIPAA is so that you understand where you are and what you need to do. HIPAA has two parts to it. HIPAA has the privacy rule, and with the privacy rule, you're required to ensure the privacy of all patient information, whether it's written, oral, or electronic. The security rule, which is what we're talking about today, is ensuring the security, the integrity, and the availability of all electronic patient health information. Availability is a very important aspect of this. Now, within the security rule, there are two types of standards. There are addressable standards and there are required standards. An addressable standard is one that you either must implement, or if it's not practicable for you to implement it, you have to address in your manual why it has not been implemented. There are some addressable standards that have many ways of implementing, and you have to talk about how you've implemented those standards, and you'll see that later on in this presentation. Now, when we're talking about an addressable standard, when you work with your manual, and you must have a HIPAA manual in your office, your HIPAA manual must document why it's beyond the resources of your organization to implement an addressable standard if you do not do so. If you do implement an addressable standard, you have to discuss how you implemented that standard. Now, within the standards, there are three categories. We have physical standards, technical, and administrative. A physical relates to the physical structure of your building, the windows, the doors, the locks, everything, the physical aspects of your building is discussed by the physical requirements within the HIPAA security rule. The technical requirements relate to how your hardware, software, and other aspects of your computers and networks are properly secured. The administrative aspects, which is what we're talking about today, are the standards that relate to the policies and procedures that you and your staff must follow on a day-to-day basis to ensure compliance with the HIPAA security rule. And once again, compliance is making sure the records are secure, the integrity is maintained, and they are available. Now, when dealing with the administrative standards, there are a number of steps that have to be taken. The first one is a risk analysis. This is a required standard. It must be done. You have to go through your office and conduct a total assessment of all the risks to the computer information in your office. You have to do an assessment of the physical, the technical, and the administrative risks, and have this documented. This is known as your risk analysis. This is required, and it's specifically referenced in meaningful use. And if you have not done this, you have not met step number 15 or requirement number 15 of meaningful use. This means you have to review everything. You have to identify all the risks that are present. This is why a canned HIPAA manual that you download off the internet will not work, because everybody's office has different risks. If you practice in Louisiana, there's a risk of flood. That risk does not exist in Colorado, at least as far as I know. I found out today that if you practice in New York, there's a risk of earthquake. Well, now my manual has to change in case of an earthquake, because we had one yesterday. We haven't had one in a long time. But your manual has to be modified to reflect the risks that are actually present in your office. So one that you've downloaded, you must modify to reflect what happens in your office. The next item that is the administrative standards is a sanction policy. You have to implement this policy of how members of your staff will be sanctioned if they fail to follow your policies and procedures or are involved in a HIPAA breach. You can decide what these standards will be, but you have to document them, and they have to be in your manual. And once you've documented them, you have to make sure that you follow them. Therefore, make the standards as vague as possible or as broad as possible, saying that, for example, if an employee who violates HIPAA can be censured all the way up to termination. And that is a valid thing. It gives you the full leeway to do anything that's appropriate in your mind based upon the severity of the violation. The next standard that's in the administrative aspects is login monitoring. This is an addressable one. Login monitoring is implementing a system that monitors who is logging into the system. When dealing with TrackNet on a Windows system, there are a number of levels at which login monitoring can be done. It can be done within TrackNet to see who's logging into TrackNet. It can be done at your operating system level to see who's logging onto the computers. Now, addressable standards, you must meet them to the best of your ability and within your resources. TrackNet has this built into it, so you have to have it turned on. If you have a Windows domain controller and people log on to a domain, you can track who is logging onto the computers. And that means you have to make sure all usernames are unique so you can see what's going on, because that's not a major thing, and it is reasonable for you to do. Therefore, you would be expected to do so. If you don't know how to do this and you have a domain controller, contact your IT vendor and have them help you through this process. But you have to make sure that you do everything that is within your resources. So if you've got a domain controller, do it. Speak to your system administrator, see what is available and what can be done to make sure that you meet the standard. The next step is the security management process, which is required. This is a process of identifying all the systems that store and process electronic patient health information and how you keep track of the various hardware and software in your office. You need to keep track of it. So if someone has a laptop, you need to know who has the laptop and where it is. When computers come in and go out and they're retired or they're replaced, you have to log it, keep track of all your systems in your office so you know what systems have information, where they're going, the entire life cycle of every piece of equipment in your office that has protected health information. The next step is risk management. Risk management is taking all of the risks that you identified in your risk analysis and addressing them and saying what you're going to do to mitigate those risks or prevent these things from happening. So your risk analysis then ties very, very tightly to your risk management, and this has to be in your HIPAA manual. The next item is assigned security responsibility. You need to have a security officer and a compliance officer in your practice. The same person can hold both positions, but they have different jobs. You can be the security officer and compliance officer. You can bring in an IT specialist who's your security officer. This is up to you. But the roles they have and what they're responsible for is specifically enumerated in the HIPAA manual, and you have to make sure that they follow their role and do their job, because a lot of what they have to do is going to be documenting what was done and keeping track of what's going on and logging how you've been compliant with HIPAA. An addressable item is workforce authorization, supervision, and clearance. It's a lot of words. What does it mean? It means that how do you make sure that the people who you've hired and are working in your practice and working with protected health information can be trusted, and what access do you give each person? The general rule of thumb is you only want to give people access to the information required to do their job. Therefore, a billing clerk will be able to see billing information but should not see patient notes. A nurse should be able to see patient notes but would not see billing information. And you have these little, shall we say, carved out areas where the people can do what they need to do but they don't have access to information not necessary for your job. Now, the question is, do you have to do a background check on everyone to make sure they haven't committed a felony? Because obviously someone who's committed a felony is at greater risk of potentially committing identity theft. So you want to determine that. You have to determine what job everyone is doing and determine what information people need access to. And then who reviews, who gets access, and who supervises. These are all things that need to be addressed in your HIPAA manual. Now, addressable, before I said what you do what's addressable, you have to either do what's addressable or document why you didn't do it. This one, there is no way to document why you didn't do it. You have to address your security policy, your clearance procedures, and state how you do it. Now, background checks are a little bit sticky because background checks, existing employees may feel a little bit weird that you're doing a background check on them. But a basic background check only costs about $29.95 through various sources on the net, and it's not reasonable not to do it. So you probably should do this and simply explain to your employees the new federal regulations require me to do it. It's not that I don't trust you, but I have to do this. The next item that is also addressable is termination procedures. What do you do when an employee is terminated? How do you make sure they've handed in all their keys? Have you changed the key codes if you have a keypad to get to the office? What do you do about their computer access? What do you do about the remote access if they were able to remote into the practice? These are all things that you need to address. That means you actually have to do something about it, write down what you're doing. You have to address them in your manual and how you deal with these situations and address them when somebody leaves your employment. The next item is security awareness training. This is also addressable. Addressable also, once again, does not mean it doesn't need to be done. It means you have to address how you're going to do it. Security awareness training is the ongoing training for your staff to make sure they stay aware of the security procedures in the office. So what you need to do in your training has to consist of their login procedures, their password management, how to make sure that the computer is protected by malicious software. Maybe they should be trained to make sure that the antivirus software is running. This is all addressable, and how you do it is up to you, but you must do something. You must do what is reasonable, and you have to speak about the things that you are not doing because they're not reasonable, because they're beyond the resources of your practice. When I say beyond your resources, there are two types of resources. Financial, so if something is too expensive based upon the size of your practice, you can say this is too expensive and it's prohibitively expensive and therefore we are not doing it. Or it can be beyond the skill level of the people in your practice, therefore we don't have the resources or the skills to implement something. So when you address things that you are not implementing, you need to be able to justify why you're not implementing them. The next item, which is a required item, is known as a security incident procedure response and reporting. When there's a security incident, you must respond to it, you must report to it, and exactly how you do it step by step, and the policies and procedures for this have to be documented in your HIPAA manual. Now, the security incident procedures and policies are extremely important because your security incident plan is going to be activated when there is a HIPAA breach. When there's a HIPAA breach, you have a problem. The better your security incident plan, the better prepared you're going to be to contain and mitigate the effects of that breach. The better you can contain and mitigate a breach, the less penalties you'll be looking at when the federal government comes in to penalize you for a HIPAA breach. And right now, as the way the laws stand, when there's a HIPAA breach, there are mandatory penalties which can top out at $1.5 million. You don't want to be there. They can be down in the hundreds, they can be in the tens of thousands, they can be $1 million. A good security incident plan and a good HIPAA manual keeps you in the low end of that range as opposed to the high end of that range. Now, when talking about a security incident plan, there are a number of steps that need to be followed. First is preparing for the incident. Preparing for the incident really is going through your risk analysis and risk management process, going through the proper process of determining who has access to what, making sure your antivirus is up to date. This is all preparing for an incident, making sure that you're in a position where the chance of an incident is minimized. Now, even with the best security in the world, incidents can happen. The federal government and the military, who have immensely complex security, have been broken into by hackers. If you think that you're going to be immune from hackers no matter what you have, you're fooling yourself. There always is a possibility of a security incident, even with the best possible security you can implement. So the question is not when will there be an incident, but when will there be an incident. Then you have to monitor your system and be able to detect when an incident has occurred. Once an incident occurs, you must report it to CMS. You then have to assemble what's known as your Security Incident Response Team, SIRT. The response team has a job of determining what happened, taking steps to limit further damage, gather evidence of what happened and how it happened, fix the damage, and then do an analysis of the incident to try and minimize the chance of something like this ever happening again. Continuing on with the SIRT team, by going through this process and then implementing changes to your security plan and procedures to prevent this from happening again, if you've done this before the HIPAA police come in and you can show them you've gone through this process, you can demonstrate to them that you've taken all the proper steps to mitigate the damage by that incident, and you're looking at a relatively low fine. So a good response plan will really be helpful when you have a HIPAA incident. The next item is security reminders, which are addressable, but these are a very good thing to have. It's basically a form of continuous quality improvement for your HIPAA security. Remember what addressable really means. How are you going to do it? Not whether or not you can do it, because security reminders can be as simple as having a weekly meeting and reminding someone, saying in the meeting, okay, remember we want to change our passwords on a regular basis, or remember we want to use strong passwords, or something like that in your monthly meetings, weekly meetings, and that's a security reminder. So you have to have a plan for security reminders. The next item is required, and this is a very important one, is your data backup. How do you back up your data? How often? What media? Do you use an off-site backup service? Do you bring if you do backups to your own hard drive or jump drives, do you bring them off-site? Because if you back up to a hard drive and put it in the drawer in the office that's locked, and your office burns down, your backup just burned down with your computer systems and you don't have a backup. So you always want to make sure that you have a backup off-site. That means you are physically bringing the backup to another location each day, or you're transferring the backup over the internet to a backup service that's holding it for you. So that way, if you have a catastrophe in your office, you still have a backup of your data and you can recover it. The next thing you need to do is test your backups. I cannot begin to tell you how many times people think they're doing a backup, then they need to restore and find out that the backup tape or disk is actually blank and there's no data on it. So you want to test your backups on a regular basis and ensure that you're actually writing data to your backups and those backups can be restored. The next item, which is addressable, is your data criticality analysis. You have to look at what data you have, what systems you have, where the patient data is, and then determine how critical is each system. How often should each system be backed up? And when you have a system crash or disaster, which systems get brought back online first? You have to have this all addressed and determine how you're going to do it. So once again, addressable means you do actually have to address this and how you're going to do it. But how you do it depends on what is reasonable for your organization. The next step is disaster recovery. What do you do if your office burns down? Because once again, one of the aspects of HIPAA is availability of data. If your office burns down and all your records go with it, including your backups, your data is not available. That's a HIPAA violation. If you have a backup off-site, you're able to bring up a computer in an alternate location, start from the backup, and you have your patient data, you have a good disaster recovery plan. So you have to have a plan in place and documented that allows you to have access to your data when a disaster strikes. So those of us who felt the earthquake yesterday, what if there was a tsunami? Disasters can happen even if you don't expect them, even if they are uncommon. Always be ready for a disaster, have an off-site backup, and a plan to be able to restore it to a computer in short order. You have to have a downtime contingency plan. Downtime is when your computer network is not available for some reason. Maybe you lost power, maybe a computer failed, or maybe something happened with your network, or something went down, something happened. Your office is still there and running, but your computers are not. You have to have a contingency plan so that way you can continue to see patients and collect information to eventually bring into your EMR when everything comes back up. Usually a contingency plan involves having backup forms for patient encounters, making sure you know where your script pads are, making sure you know where order pads are if you have to send someone out for lab tests, but you have to have contingency plans in place when the computers are not available. The next step is known as emergency mode operations, testing, and revision. Emergency mode operations is something that happens when your computers are not available and it's an unexpected unavailability. There will be times when you take your computers down for backup or for maintenance. That's not emergency mode operation because you have planned on it and you're ready for it. But if something happens that is unexpected, you need to be able to recover from it. And you also have to have your disaster recovery plan, and you actually have to test it. You want to test that plan and make sure that it actually works. So every once in a while, you want to say, okay, let's pretend the computers went down and not available. What are we going to do? And go through a test. Every once in a while, you want to test your disaster recovery plan and see if it works. If there are weaknesses, you want to address those weaknesses, and you want to make adjustments to your plans so that way those weaknesses and those holes in your plan can be plugged. Hopefully by now everybody has a HIPAA manual, and that HIPAA manual is a living document. It needs to be kept up to date. The reason you need to keep it up to date is the technology available to you for compliance with security will change with time. The hardware will change, has to be updated. The software will change. Viruses will change. You may get different antivirus software. You need to constantly maintain and update this manual to keep it alive and pertinent to today. A manual that is written today will not be valid in 2 to 3 years. If you don't keep your manual up to date, you are not staying compliant with HIPAA. The last item in the administrative aspect of HIPAA are your business associate agreements. A business associate agreement is a contract with anybody whom you share patient data with that contractually obligates them to protect that patient data at the same level that you do. If someone does not have a business associate agreement, has not given you one, you are legally not allowed to share data with them. This includes orthotic labs, it includes transcriptionists, it includes billing services, it even includes TrackNet. TrackNet has a business associate agreement, BioMedix does. They will be very happy to send it to you. Simply contact them and ask them for a copy of the business associate agreement. You do not need business associate agreements with other doctors and providers because they are required to be compliant with HIPAA on their own. So a laboratory such as LabCorp or Quest or Baco, you do not need a business associate agreement with because they are providers to the patient. They bill the patient directly. You need it with the orthotic labs because the orthotic lab bills you and they do not have a relationship with the patient. I know we just threw a lot at you today, and as I said, this is a first glimpse. This webinar will be on the BioMedix website. I encourage you to listen to it numerous times to get a feel for it. After you've listened to it, if you have a HIPAA manual, read through it. You may find things in your manual that you need to change to properly reflect how things are going in your office. Because your HIPAA manual is not a manual that says this is how it should be done. It's documentation of what you are doing and how your office is taking steps to ensure that your data is safe, secure, and available when necessary. Now, if you look in the little control box, there's a little orange arrow. If you open that up, there's a box that says questions. If you go to the box that says questions and type in your questions, I'll be happy to answer your questions. Okay, first question. We're having some difficulty in submitting the application to Medicare and having it accepted by them. Are there any suggestions as to an easy way to do it? Well, since I'm not sure which application, there are two forms on Medicare. One is a form that you fill out to register that you intend to meet meaningful use, and the second is the attestation form. Either one, there is an organization, CPS Collaborative. What's the term? What's the Amber? CPS stands for. I'm brain dead here. Are you there? Oh, CPS.
Collaborative Practice Solutions.
Collaborative Practice Solutions. can help you with that. They are very familiar with TrackNet and can help you through the application process and through the attestation process. How do we get a copy of this webinar manual? Okay. There is no manual. The webinar is a webinar, manual is a manual. This webinar will be up on the BioMedix website in a week. Does TrackNet have any type of prototype or template that can be used as a specific guide for what is required? Okay, Vincent, if you could get a template or prototype, if you're talking about a HIPAA manual, I have developed one for TrackNet users. You can contact me and we can talk about getting you one. Okay, any other questions here?
Okay, if that's all for questions, we'd like to thank Dr. Brody.
Okay, Vincent, if you need the response, contact me offline and I'll help you get set up with a manual. I'll give you my email address, mbrody@cmeonline.com. And just give me an email and I can help you get set up with the manual.
Okay, thank you to Dr. Brody and to all attendees who joined us for Understanding HIPAA Compliance Administrative Security. For more information about BioMedix products, please visit www.biomedix.com, call 877-854-0014, or email info@biomedix.com. Please join us for our next webinar on September 13th at 7 p.m. for cardiovascular disease and your patient. What is impacting your patient?
Okay. Yeah, Amber, people are asking for my email, so if people open up their chat box, I'm typing it into the chat box right now.
Okay. To register for our next webinar, visit the events page at www.biomedix.com and click on the webinar link. For more information on upcoming webinars and trade shows, visit the events page at biomedix.com. Please remember to fill out the short survey. Your feedback is appreciated. Thank you for joining us this evening, and we are adjourned.